Okay, now we've just completed our care guidelines for a diabetic patient, and now we're going to show you how to create a document that goes over this information and also how to do some screening questions over the phone when you're contacting the patient. So first thing you want to do is make sure you've selected the guidelines you're working with, in this case diabetes, because there are several that the patient can be enrolled in. And you'll either scroll down and open up your screening questions, or if you want to stay at the top and just cycle through to the screening questions, you can do that. So these are some very simple yes/no questions you can have with the patient. Are you checking your blood sugar at home? Yes. Are you checking your feet each night? Yes. Been following your prescribed diet? Yes. And are you following your prescribed exercise program? Yes. Lost weight since your last visit? No. Any problems with current medications? No. New symptoms since last visit? And are you using any tobacco products? Now, of course, you can comment out here to the side. Let's say the patient is checking fasting once daily. Okay, and then you'll want to save that information. Now there are some more categories here that are mostly for review, so if you cycle down to metrics, you'll be able to see any of the patient's labs. That's not in here right now because this patient doesn't have any. Vital signs, again, you can review their last BMI, their weight, blood pressure, those sorts of things, which you need to do with them over the phone. Look at their immunizations to make sure that they've actually completed the ones that are recommended. If you want to talk about their nutrition, you can. And then drug therapy, this is going to show their medication list. And then recent orders. So if you cycle back up, you're back to your clinical guidelines. Now, you can do this either at the beginning of the encounter when you're talking with the patient, or you can do it at the end, but you want to make sure you click on this radio button that says Detailed Document. It'll put a date here, and then the last thing you want to do is save and close. And the window will go away. Now, you'll notice this care guidelines doesn't have a red number anymore. That's because we've satisfied their care guidelines. And then the last thing you want to do is generate a document. Now we're going to create a document that you'll be able to click under here and select. That will be titled Care Guideline. However, right now we don't have that, and so that for the beginnings of this, you'll just click the Master IM, and it's going to generate your document. And it'll have the basics of what you need here. So, it has the patient's diagnosis, clinical guidelines. This is all the information we did today. We'll try and create a little bit better column widths so that it's not quite so smashed in there. And then when you're done, you'll just click the check mark. And you'll close it. And you've completed your care guideline summary. Now you can always go back in here, and again it'll be listed as a care guideline document, and we'll have hopefully a separate category under notes for care guidelines. So that way when the provider sees the patient at the follow-up encounter, they know that they've been through the care guidelines and that these recommended screening issues have been addressed. So good luck with that. Again, there's going to be some changes to this as we roll it out. This is very fresh and new, and it's a little bit rough, so we'll try and make it better. But if you have any questions, comment below or get a hold of one of us in the office, and let's work together to try and make this as good as it can be so that we can improve the care of our patients. Okay? Thanks.